Hey everyone, it's Justin here. Not sure what you want to do for a living as an adult? You're not alone. Remember, at the introduction to this unit, we told you that surveys show that only 20% of Americans are actually passionate about their jobs, and 21% are eager to change career paths. Today, you are going to get the chance to meet someone who's done just that. Amy Bernarski graduated from college with a degree in communications. She's worked in several different occupations since.
I've had a lot of different jobs. I've worked retail, I've worked customer service, I've worked as a dermatologist.
Like so many others, Amy was searching for the right fit, one that she feels passionately about. She thinks back to her childhood for inspiration.
I like helping people, so I really like helping my grandmothers, and I like helping my mom.
When she was little, Amy didn't really see helping others as a career path. In fact, she wanted to be a dancer, or perhaps a ballerina, but lessons were expensive.
We really didn't have the money for all of that growing up.
In school, Amy liked reading and science classes, and later enjoyed learning Spanish. Those led to her degree in communications and several different jobs. None sparked the passion she was seeking. Then, Amy realized that perhaps she should think more about helping others. She decided on the medical field.
I was looking to get into nursing school, so I was doing my prerequisites, and I really thought I need to get some hands-on experience and actually to pursue the career to see if I actually wanted to do nursing.
Amy is getting that experience as a CNA, which stands for Certified Nursing Assistant, at a nursing home in Siloam Springs, Arkansas. There, she rediscovered her childhood passion for helping others. In fact, it's one of the primary requirements for the job.
And I really have to have a love for the elderly and a love for people.
Amy has that, but other character traits are important as well.
It's really important to be a multitasker. So you have to really be quick on your feet. You have to be very patient. It takes just a lot of energy and stamina.
The job is demanding and fast-paced. Amy said she arrives at work about 6:30 each morning and immediately receives status reports on patients. From there, she checks their vital signs.
So I'll have to get a pulse ox, I'll have to get a temperature, and I'll have to get blood pressure readings on most of the residents, probably we have on our hall about 34 residents.
Pulse ox is short for pulse oximeter. This instrument measures the oxygen levels in a patient's blood. That's one of the things Amy learned in a 3-week class preparing for the job.
Then there's a lot of homework and in class, and then you actually have to pass your skills test and your written. And it's not as easy as some people think, but you do have to study and work really hard to get your license.
CNA programs are offered at many community colleges, vocational schools, hospitals, and nursing homes. Nursing assistants also complete on-the-job training as well as hours of supervised clinicals and passing their state's competency exam. Obtaining a CNA certificate is a first step for an individual who's pursuing a nursing degree. Once you receive your CNA certificate, working in a hospital is only one option.
As a CNA, you can work a multitude of jobs. You can work nursing home, which I work at. You can work home health, so you could actually go into the homes of the elderly that have that. And then you can also do assisted living.
As of May 2020, approximately 1.5 million men and women worked in the United States as nursing assistants. More are needed. According to the U.S. Bureau of Labor, employment of nursing assistants is projected to grow 8% through 2029, which is much faster than the average for all other occupations. Despite the need, many don't last in the position.
It's just a high turnover job.
Part of the reason is due to the pay. According to the U.S. Bureau of Labor, a certified nursing assistant made an average of $14.82 per hour in 2020, with a median annual income of $30,850, well below the median annual income for all jobs. Amy thinks that could be changing.
One positive thing I would say about that is, I've been reading many articles about low pay for CNAs. And since the COVID has happened, they realize how it's just a high turnover job.
To counter the turnover, several employers are increasing pay for CNAs. Still, for many, including Amy, the job is only temporary.
I don't see myself doing this forever.
Amy has changed careers before, but she believes healthcare may be her calling as she works as a CNA and studies to be a nurse. But education isn't the most important requirement.
I think the love that you have for people outweighs any kind of skills.
Amy has that love and compassion for others, and now she's found the right career to share it. Amy, thank you so much for sharing your career path and insights with us, and for reminding us that it's good to keep an open mind and stay flexible when you're looking for the job that's right for you.